right, so good afternoon, everyone, and welcome once more to another informative session on here as part of our World Diabetes Week partnership with the Jamaica Library Service. I am Rosanna Pai, the Health Education Officer of the Global Health Advocacy Project at Heart Foundation of Jamaica. And today we have with us Mrs. Patsy Edwards Henry. She is a registered nurse and midwife. She's been working at the Victoria Jubilee Hospital for 29 years. She has served in a number of capacities at the Nurses Association of Jamaica, such as Secretary, Vice President, and now the President of the Association. She has also served on a number of national committees, such as the Jamaica Coalition for Tobacco Control and Chairman for the Monitoring Committee of the Government Health Plan. She's also a secretary for the Caribbean Nurses Organization, and she is married with two adult children. Her philosophy is do it right the first time. So, ladies and gentlemen, let's welcome Mrs. Patsy Edwards Henry.
Okay, so good afternoon. So thank you to the Heart Foundation of Jamaica and the Jamaica Library Service for having me this afternoon. And today I want to talk to you about the all-important role of the nurse in diabetes care. And, sometimes I spoke with somebody the other day, and when I told them about the role of the nurse, they were saying they didn't understand that the nurse was so important. But yes, the nurse is very important. And this year, 2020, the World Health Assembly has declared and dedicated this year, with all its challenges, as the International Year of the Nurse and the Midwife. So we are actually celebrating this year, and during our celebrations, we've had this great pandemic, but then our role has increased even more. And as we celebrate World Diabetes Day on Friday, World Diabetes Week this week, the role of the nurse becomes even more important. So my screen is not going. Oh, there we go. So the nurse and diabetes. So the first question that we're going to ask is, what is diabetes? And that's the answer that will come to most person's head: sugar. And you see how I'd have one of those donuts now. But the definition for diabetes is that diabetes is a let me fix this. There we go. Diabetes, or diabetes mellitus, as it is called, is a chronic multisystem disease. And when we talk about multisystem disease, we are talking about a disease that affects all the systems. So it affects the heart, it affects the kidneys, it affects the skin. So it is multisystem, and it is related to abnormal insulin production or impaired insulin utilization. And we must understand that insulin is a hormone needed to allow sugar or glucose to enter the cells to produce energy. So either we do not have enough, or we have enough, but our body is not using it properly. So what causes diabetes? And we understand that it may be genetic. And when we say genetic, we speak to being born with it. So our parents had it, our grandparents had it, or our great-great-grandparents have it, and we get it from our genes. It may be autoimmune. And when we say autoimmune, what do we mean? It means that the body, for some reason or the other, is fighting against its own self. And therefore, in an effort to do that, it is destroying the cells that produce insulin. And those of us who have done biology, and those are our students, know that insulin is produced in the pancreas of the body. So what starts this autoimmune system, nobody knows, but it happens. Then we look at our viral factors, and sometimes we know that some of the conditions that we have are caused from viruses like mumps and rubella. The all devastating rotavirus that causes flu at the end of the year. So sometimes when persons have these viruses, they can end up developing diabetes as it affects the organs. And environmental speaks to our unhealthy diet because they said you're not to eat a lot of sugar. It speaks to our lack of exercise and physical activity, especially in this pandemic when we are being told to stay home. And a lot of persons are doing a lot of work on the computers and tablets and the watching more television and living a more sedentary life. So the physical activity has become less. Stress and vitamin D deficiency. Well, we shouldn't have much vitamin D deficiency because we have the beautiful sunlight. And then, so those are the factors that may cause diabetes. And it is said that there are two types, so type 1 and type 2, simple. So type 1 was once known as juvenile diabetes or insulin-dependent diabetes. So this is the one that persons would be born with. So it's chronic condition, which the pancreas produces little or no insulin. And despite active research, type 1 diabetes has no cure. So the treatment focuses on managing your blood sugar levels and your diet, your lifestyle, and prevention of complications. So our type 1, so we'll find a lot of our young people in need of education suffering from type 1 diabetes. Then our type 2 diabetes is a chronic condition. And when we say chronic, we mean it's long time, over a period of time that affects our body, how our body metabolizes the sugar, how our body breaks down the sugar. And we used to call it adult onset because a lot of times is when you reach up in age and they say you eat too much sugar or you don't drink enough water, that you become diagnosed with type 2 diabetes. But today we are noticing that a lot more children are being diagnosed with the disorder. And one thought is that because of the rise in childhood obesity, and I know that the Heart Foundation is doing something on obesity also, there is no cure for type 2 diabetes, but losing weight, eating well, and exercising can help to manage the disease. So we're seeing that diet plays a big role in managing diabetes. So let us talk about the nurse and her role that she plays in diabetes care. So it is said that the nurse has an important role and clear responsibilities when treating patients with diabetes or who are having tests to diagnose diabetes. The nurse is a part, and we know, of the healthcare team, and the nurse is considered a privileged member of this team. But then there is a big question. A big question. Why is the nurse so important? And let me tell you some of the reasons why. Number one, the nurse has more time to listen and educate. So the nurse is the one who's in the, and I want to jump to number 3 before I go to number 2, because the nurse spends more time in the care setting than any other professional. And it must be noted that the nurse makes up more than 50% of all healthcare professions globally. So this is not just in Jamaica, but across the world. Any healthcare facility that you step in, you will find a nurse because the nurse makes up more than 50% of the workforce. And one of the all important factors, and I was having discussion with a friend the other day, and I explained to her that I'm multilingual and multifaceted, is because the nurse is most times the interpreter between the doctor and other healthcare providers and the patient. So when the doctor sits the patient down and explains at length that you are being diagnosed with diabetes and you have to now stop eating this and stop eating that, the patient comes out of, say, yes, doc, then comes out of the doctor's office and said, nurse, what doctor just say? The patient will go to the dietitian, and the dietitian or the nutritionist, whomever, will sit down and will explain to the patient that they are supposed to eat from the how many food groups they're supposed to have, a distribution, a serving of fruits and vegetables, and so, and the patient will say, yes, ma'am, yes, sir, yes, ma'am, yes, sir. Then the patient comes out and says, nurse, I wouldn't just say. And the patient does this for almost every category. We'll go to the physiotherapist, and the physiotherapist will explain how many times and the types of activity that needs to be done. Nurse, what is someone must do? So the nurse interprets. So the nurse has a very important role as the interpreter, that advocate that goes between other healthcare professionals and the nurse. So some of the roles of the nurse include, but are not limited to: one, screening, prevention, and early detection; promoting self-care; monitoring mental health; and nutrition education. So let us quickly go into what some of these are. So as the nurse helps in the screening, prevention, and early detection of diabetes, she helps to describe the risk factors to the client or the patient. So she tells the patient that the mere fact that the patient may not come for diabetes, the patient may come in for another challenge that they're having. Patient may be pregnant. Patient may be at the health center with their child, but the nurse is the one who will see the risk factors and say the fact that you are at a certain age, or the fact that your weight is so and so, or the fact that your mother or your grandmother or somebody in your history, one of your family members had diabetes, you may be at risk for diabetes. So the nurse helps to describe the risk factors, identify and describe the risk factors, and then explains the importance of prevention or delaying the onset of diabetes to these individuals that are at risk. So if you are at risk, the nurse is the one who will explain to you that it is time now that you start cutting out the sugar out of your diet. It is now time, and all of it is interrelated, because she will now educate you about your diet. And when we go further down, you will see some of the things that we educate the patient to as it relates to their diet. Support the patient and help them develop their own self-care plan. So it is said that nobody else can live in your own body but you. You have to take care of yourself, and nobody can take care of you better than you. So we have to support the patient or the client and help them develop their own self-care plan, because you know you better than anybody else. So if it doesn't make sense, you tell persons that you need to do A, B, and C, when for the patient, it is easier for them to do B, C, then A. So we help them to develop their own plan within limits, that is, to make sure that they are taking care of themselves. We observe and report any concerns. We advise the patient to report any concern that would affect them or their ability to take care of themselves. So you say that you need to eat a balanced diet, and you need to eat 3 or 4 servings of vegetable and fruits per day. But then you look at the patient's income, and you realize that this patient is not going to be able to do that based on their income. So we have to develop alternative plans within limits to help them to meet their needs and take care of themselves. And we encourage the patients or the client to use their personalized care plan. So once you've made the care plan, stick to it. You made it. It should be objective and within your reach, and we encourage the patients to stick to their care plan. Now, the next aspect is extremely important, because a lot of persons, once diagnosed with a condition, some people think that it is a death sentence. Now, the nurse must have an understanding and awareness of how mental health issues such as depression, anxiety can affect persons with diabetes. I have met patients with diabetes who are afraid to sleep because they don't want to go hypo or hyperglycemic in their sleep, and go into a coma and not able to wake up because they don't have anybody who lives with them who would be able to help them. So depression and anxiety can affect persons with diabetes, and it is for the nurse to understand the challenges and help persons to work through these challenges. And the nurse reports any changes that is noticed in the patient's normal mental health, and this could include a change in their medication adherence. So you have a client who used to wake up every morning and take the insulin, and all of a sudden they stop taking the insulin. That's a red flag. Their mood, jovial, always happy, they have the diabetes, but they're living with it, and they're taking their medication and sorting themselves out. All of a sudden they start getting depressed, unhappy, their appearance, and also if they are anxious. So we need to monitor and report and address any changes that may occur as it relates to the patient's mental health status. So a big thing that we do in education is we talk to our clients about their nutrition, because with diabetes, or sugar as some people call it sugar diabetes, we call it DM, whatever. Food is an important aspect because we now have to manage what we put into our bodies. So we now have to identify food and drinks with high sugar content, encourage patients or the clients to follow their nutritional plan, and will report any related problems. Now, it is important that they follow the plan, right? Because it is not that you cannot have a sweet meal or a sweet drink. It's just that you must know, for today, I will have my sweet drink in the morning, or my only sweet drink will be at 7 or in the morning when I have my cup of coffee. So if you have that in your plan, you stick to it. Try not to deviate too much from the plan. Measure and record your weight, your height, and your waist to see if you are putting on or losing weight, because with diabetes, you can either gain weight or you can lose weight. And you report if meals are not eaten, especially carbohydrates. Because remember that even although you're diabetic, you're still supposed to eat from all the food groups. It's just that you have to balance the diet, that you don't take too much of one. So including your carbohydrates, so you won't have too much simple sugars, but we will determine whether we're going to have some food over rice. And if you're going to have rice, your proportions of rice that you're going to have as it relates to your food. Because if the client is on insulin, then it is important that the patient does not take the insulin without having their meal, because we do not want them to become hypoglycemic. So in our education sessions, we teach our patients to perform how to test their urine unsupervised, how to test their blood glucose unsupervised, and to document and to report. So we have the urine testing utensils. We have our blood glucose. Some of them are a little stick, and if you watch the television, you will see where we're getting advanced, and you can have the fancy tests that you do. But whatever the test is, it must be done according to the manufacturer's instructions. So you don't want persons to be testing their urine or their blood glucose and they're not doing it properly, because as a result of that, you may have that the results may be out, and it is because they are not following the instructions of the manufacturer. And once the tests are done, they must document and report, because it doesn't make sense you constantly do the tests and you don't document and report, because documentation and reporting helps in guiding your care, whether we have to step up the insulin or the medications have to be increased, or whether or not they can be decreased. When we are doing our education, we need to recognize and follow quality assurance procedures. So those persons who have to take insulin and use the needles, they must be disposed of appropriately. We don't want to have the needles all over the place where children and animals can identify them and they can have access to it. We must dispose of all our medical waste appropriately. So you are taught how to do that. It is important that we teach how to recognize impending signs of hypo and hyperglycemia and be able to administer the medication or the glucose or whatever it is when you have the feelings. So persons and different persons is not a one size fit all. No one suit fits everybody. So one person will tell you that when I go in hypo, I know when I go in hypo, because my eyes get dark. Another will tell you that I start to sweat. Another will tell you that I feel confused. Another will tell you that I feel hot when my blood sugar is high. And each person have their own way of identifying the signs, but we teach them how to recognize. So how you feel when you are going low, and they'll tell you and you say, okay, so you know that you need to have your medication or your glucose or whatever it be, that when you feel that way, you can act quickly and understand. So when you know what your how it feels to be hypo and hyper, you have to know, understand the normal range. So once you do your reading and you realize what the normal range is, you will know whether you are inside or outside of the range, and then you can take the necessary action. So education is a big part of caring for the patient with diabetes. Now, this is not a long presentation, so I just want to tell you that diabetes is one of those conditions that once you get it, you don't lose it. It's one of those lifelong conditions. As you remember in the slides up, further up, it says that they have been trying to find a cure and they can't find a cure. It is, however, not a death sentence. We have had persons who have lived long, productive lives with diabetes. We have persons who are born with diabetes, those who develop it in childhood, in adolescent, in young adults, in middle age, in upper middle age, in young, is it upper middle age, then lower old age, then old age. But whatever your state is, there are persons who have had it, and it can be controlled. And remember, the nurse is your lifelong partner. Work with him or her, and your journey will be way easier. So, if dad knows, don't be alarmed. What do? Keep calm and call your nurse. A sweet thank you to you all.
All right, awesome. And thank you so much for that very, very, very interesting and informative education session, Dr. Patsy Edwards Henry.
Nurse.
Sorry, my apologies, nurse. All right. And just as I learned a lot, I am pretty sure our audience learned a lot, right? Both here on Zoom and, watching our live stream. And at this moment, what I would like to do is to invite our participants, to go ahead and throw your questions to Nurse Henry. So we have like a 5-minute session that we can do question and answer. So you can go ahead. In the meantime, what I'll do, let me check our YouTube to see if anyone over there has any questions for us. Okay, so our YouTube is our participants, to go ahead and throw your questions to Nurse. All right, so on the other live platforms, anyone has any questions for Nurse Henry?
I either confused you totally or it was clear as mud.
All right, there was one question from Nurse Annette Moody Campbell. It's not really regarding the presentation, but regarding CME credits. Maybe you want to address that off the
That would be that would be, I would have to talk to the members of the Heart Foundation, and then those who would want continuing education hours could let me know, and I could direct that to Kay, and then we could work on that.
Okay, no problem. Anybody else has a question for Nurse Henry? If you're not able to actually voice it, you can go ahead to type it in the chat. I'll give another minute. If no one has any, then we will go ahead and close out.
Latar Barker is on.
Sandra has her hand up. Sandra Chisholm Ford.
Okay, she can go ahead.
Go ahead, Sandra. Unmute your mic, Sandra, if you're gonna speak.
Sandra, are you able to speak? If you're not, you can go ahead and use the chat option.
Good afternoon.
Good afternoon.
I'm sorry, it's not a question, it's just a comment. I just want to thank the presenters. I want to thank the organizers. It was an interesting presentation. I logged on at 2 to hear my president speak, and I must say thank you very much. Most of what I heard really reminded me of what I'm missing in med-surg and general nursing. And whether you are a nurse or just someone who is interested in diabetes and its management, the presentation was crystal clear, and I want to lobby for more of such presentations.
Thank you very much, Sandra. There is a question in the chat which asks, should I not eat because my sugar is high? And the answer to that is no. It's not that you should not eat, but if you are diabetic and if your sugar is high, you need to know whether or not you need to take your medications, and based on or you may have to change your diet, or you may have to visit your healthcare practitioner, because if your sugar is high and it is constantly high, then it means that something is not being done right. So it's either we need to change the medication, increase your physical activity, change your diet, but you do not stop eating because your sugar is high. You take the other necessary precautions, because we can't stop eating. Eating is one of the things that we have to do. It's what maintains us. So no, you do not stop eating, and you do not take sugar totally out of your diet. It is the amount, so it is for you to get the necessary guidance, and that's why the nurse is here. So you can go to your health center, you can visit your nurse practitioner, or your clinic, and the nurse will advise you how you move forward. But definitely not, you do not stop eating.
Thank you so much for answering that, Nurse Henry. And anybody else has any questions they want to go ahead and ask?
All right. There's another, I think it's the same person, is saying that some patients complain that they are told to keep NPO when your sugar is high. No, NPO is nothing by mouth, for those who don't know. It's nil per os, and in the medical terms, it means nothing by mouth. We don't encourage you not to eat, as I said before, but then the necessary precautions will have to be put in place once your sugar is high. It definitely means that something is wrong, and we need to alter or adjust some aspect of our lifestyle or our diet or our medication. All right, you are most welcome.
All right, and I'll ask once more. Any other questions or comments? You can go ahead. Going once, going twice. Okay, so I suppose we're all crystal clear. And as Ms. Sandra Chisholm commented earlier, I share same sentiments because Nurse Henry gave a very, she expounded on not just the role of nurses in managing diabetes. And I think that's something that we underrate nurses so much. They're everyday heroes. So we, here at Heart Foundation, and JLS, we actually, we're here, we're doing a display and we're honoring them at the same time because they're everyday heroes who we underrate so much and we take them for granted, right? And she also went on to talk about, managing diabetes, stress management, education, taking your medication, nutrition aspects, right? And it was, as she said, crystal clear. And so we're gonna go ahead and close out our session today. So thank you so much for that again, Nurse Patsy Edwards Henry. You can feel free to join us live here again tomorrow and for the rest of the week. Tomorrow at 10 a.m. we will have Juanetta Nurse. She's an advocacy officer at the Heart Foundation of Jamaica, where she'll be talking about nutrition label reading and front of package labeling, because that's also an important part of managing your diabetes. The following day at 11 a.m. we will have a consultant psychiatrist covering COVID, diabetes, and stress management. And on the 19th, we will talk about studying nutrition and managing your diabetes with Marie Powell, who is the regional dietitian at SERHA. So once again, everyone, hope you had, it was as informative for you as it was for me. And I do hope you all enjoyed the rest of your afternoon.
Can I just ask, thank you for having me. Can I ask that you ask Kate to send me all those links that I could send out so persons could join at when it is convenient for them to do so.
Sure,
thank you.
Also share
and congratulations on this endeavor. It's a great thing that you're doing. Thank you.
Thank you, and we thank you too. All right. So what good, everybody?